The Psychiatric Nurses Association has given notice that it will escalate its industrial dispute by implementing an overtime ban on January the 31st, February 1st, 5th and 6th, with possible strike action on the 12th, 13th and the 14th. This has not happened overnight, and it is not taken lightly by the Psychiatric Nurses Association or its 6,000 members. They do not want to be on strike. They want to be providing the high quality of care to patients that they are trained to give. But it is impossible for them to deliver that high quality of care due to overcrowding in hospitals, due to a crisis in pay and conditions that they work under, and due to the cost of living that they have to face. Nurses are the lowest paid core salary graduates of any health profession. The staff shortages in mental health nursing are very real. There is a recruitment and retention crisis in mental health. There is overcrowding in mental health. It is clear that staff shortages are the main obstacle to the implementation of the government policy in mental health as set out in the Vision for Change. Again and again throughout the country, when we hear that young people or adults who need mental health services can't obtain them, it is because the staff are not available, be they nurses, psychologists, psychiatrists or allied health professionals. Mental health nurses are voting with their feet. They're resigning or they're changing their speciality. There is a 40% increase in vacancies in psychiatric nursing positions between November 17 and September 18. That's a phenomenal increase in such a short period. They are under intolerable stress. There is burnout, there is isolation, and their own mental health has been put under serious strain. We've also seen a significant increase in the level of assaults on psychiatric nurses. There was 11 in 2015. There was 149 reported in the first 10 months of 2017, a 15-fold increase, again, in only a couple of years. This year, due to the Confidence Supply Agreement, an additional $55 million was provided into mental health services. The same amount was effectively spent on agency staff last year. And there's a Brexit context here. I was glad to hear that a common travel agreement has been reaffirmed by the government. But it is clear that the UK government intends to seriously restrict the amount of workers that can come from the continent to work in the UK. They are suffering their own crisis in mental health staff, and in particular nursing, because continental nurses who are going to the UK are no longer going there. And the UK have started a recruitment campaign to target nurses. And no doubt, with the Common Travel Agreement, which is to be welcomed, being reaffirmed, Irish nurses will be the target. It is not that nurses are unreasonable. They are well known for expanding their practice and abilities. They were some of the first in the world to adopt nurse prescribing and took on prescribing for X-rays, for example. Nurses are reasonable, they are asking reasonable questions, and it is time the Minister met them and gave them a reasonable response. Thank you.